good morning. I'm going to do an incentive spirometry. So I'm going to check the patient's charts to see what is going on. And like for this, I can do this after post-op, just to open up their lungs. And that way they don't get atelectasis, nothing, get their mucus out if they have any mucus, anything in their lungs. So once I'm done checking the charts, I can go into the patient's room. So I sanitize hands, and then I knocked on the door and introduced myself. Hi, my name is Amy, and I'm a respiratory care student with the respiratory care department. And then I'm going to check their ID band to make sure I have the appropriate patient here. So then once I got the ID band checked, then I'm going to wash my hands, dry them, and then I'm going to check their vital signs and listen to their lungs before I give them a breathing treatment, okay? So once that is all finished, I'm ready to go. Before anything, I have here a volumetric exerciser. Before I use this on the patient, I need to make sure everything looks good. There's no cracks, nothing in the machine. So once it looks okay, then we're ready to begin. So before giving a treatment, I always need to demonstrate to the patient, that way they have a clear understanding on how to properly use it. So here is the volumetric exerciser. And for each patient, depending on their situation, we'll have a set goal for them to set this yellow piece up for the inspired volume that they need to get to. So every thing has a little chart here. So there's female and male, and it goes based off of the age and height of the patient. And so for me, I'm between 20 and 25, and so then I do 1900, 1850, and then I would go and set that at my thing. But if they're post-op or like such an elderly patient, and then I can set it at a lower goal. That way it gives them a chance to kind of don't overwhelm them with it, and then it can just continue to practice. So when I'm ready, I'll get the mouthpiece ready. I'll connect it to here. And then with this, I can have a meter that can also read to see where their inspired volume is when they do the procedure too. So when I am ready to go, I'm going to instruct the patient to take a breath in and then exhale fully. And then on inhale, I'll have them do a tight seal around the mouthpiece. Make sure their tongue is underneath and not occluding the opening of the mouthpiece. So and when they breathe in, I need to have them hold 3 to 5 seconds, at least until the piston here goes back down to the bottom. So I'm going to have them breathe in, then exhale, and then I'll have them exhale away from the mouthpiece. And with this machine, if they have to do several attempts, I always give them a rest between each deal, just that way they don't hyperventilate when they do this, or that way they don't feel like they may pass out or anything like that. So when I'm done and I'm going to leave this with the patient, I would set it next to their bedside. That way they can reach it, and I can cover the mouthpiece if they're going to be using it for that hour. And they need to do it at least 6 to 10 times per hour. And if they are finished, we can remove this, and then we can clean this off. If they're ready to go home, we wash this off, air dry it, and place it in the appropriate bagging. And then at the bottom of every machine, so there's a patient name here. So we can put the patient's name, the patient's room number, and the date that I have given them the machine to help them exercise their lung volume. Now with certain patients, especially if they're post-op, we can have them with a pillow or something that they feel comfortable with holding as they do it, because it can be very uncomfortable sometimes if they have to sit up with the machine. So every time I'll have a patient sit up. That way they can get a good lung volume when they do the exercise, the volumetric exerciser. So when I am finished, I'm going to wash my hands again, dry them, then I'm going to reassess the patient, see where their lung sounds, see what they sound like, and then I'm going to check their vital signs to see where they are at. And then I will chart Once I'm done, I'll wash my hands, chart everything that I have done for the patient, and I'll make sure I mark to see where their goal is at, and if they didn't reach there, then I need to write down where they got to and where they're gonna work towards. And then I'll let the either physician or nurse know that they have done a long exercise, that way they're aware of that.